My name's Alastair and I founded Mental Health Change probably about 3 years ago, but we're going to currently talk about the situation from June 2020 when I set a group up that was specifically looking to improve the ways mental health could occur for people who are suffering. The group was made up of lived experience individuals and has grown significantly since its origination in June last year. The systems that are currently in place are not working for the individuals. This in turn is creating a lot of stress and strain for individuals, not just the individuals, but it has a ripple effect. It impacts all of the people around those individuals. It impacts the family, it impacts the children, it impacts the employer, it impacts the employees. Where a suicide occurs, the impact, the ripple effect that I'm talking about, will impact on average 137 people. Now, obviously, if we can reduce the amount of suicides that are occurring within mental health and we can improve the systems to stop anybody getting near mental health suicide, we're going to be achieving something quite remarkable. Since June, the group has put together a number of different strategies that we believe will be able to enable that to occur. The suggestion that has by far proved to be the most significant that people are interested in is a 555 national helpline. Now you might think 111 is, in the UK, doesn't necessarily provide exactly what you want, but the purpose of 555 is based on 1737 in New Zealand. 1737 in New Zealand has been working since June 2017 and is government backed. 555 would be similar to 111 in terms of parity of esteem. It would also be the same as 999. It would be the mental health helpline that everyone would be able to remember. So anybody who is suffering with a mental health illness only has to remember 3 numbers, 555. This was one of our very original propositions from June, and Helen Grant, our MP here in Maidstone, she has taken that on board and has sent that through to the government with the proposals for this to occur. We've also spoken to the likes of Dr. Rosina Allen-Khan and Sir Norman Lamb, who both support the principles of what we're doing. I'm going to jump forward very quickly to December, when one of my team spoke to me regarding a company called Minerva. I've been speaking to a lot of people during this time, and the interesting thing was the fact that Minerva have been doing trials with people in Cornwall, 200,000 people, and they've been able to offer therapy within 48 hours. Instead of waiting for numerous months to actually get to see anybody and mental health illness worsening through that period of time, there is the possibility that patients are able to be seen within 48 hours at times of their convenience with the same therapist. So this makes the change that instead of being professional led / NHS led, this puts the provision into the hands of a patient suffering. The patient is able to make appointments at times of their convenience. They will be seen by the same professional, and on top of that, the service is open from 7 o'clock in the morning till 9 o'clock at night, 7 days a week. They will be able to receive treatment from the same person. And the beauty of what we're hoping that this is going to be is that it's going to be free of charge to the user. By being free of charge to the user, this means that the majority of people will turn up for their appointments. At present, the do not attend rate is between 5 and 10%. Compare that to the situation for mental health patients, which is between 20 and 40% through the NHS. Why does that happen? Well, it's quite simple. If someone goes and says to you, you have to be here at Tuesday 3:15, That's not always convenient. If you have the choice to be able to make your own appointment at 5:15 on a Thursday evening, that is so much more beneficial. The aim of this is to get people treated at the start of suffering. We're trying to create prevention of mental health. We're not attempting to replace the excellent work that the Samaritans do in terms of suicides or any of the other suicide helplines. We are attempting to create prevention information for patients and for families through this helpline by providing them with signposting, by providing them with potential therapy, providing them with guidance, and providing them just with a listening tool. Because the people on the end of the phone will be trained to do precisely that. We're looking at being able to deal with all levels of people in terms of mental health illness, from the start through to the end. But ideally, we're aiming to get as many people on board as possible to recognise the fact that they need to deal with their mental health illness as soon as it starts to occur. By dealing with it early, we are going to be able to prevent so much harm, not just for the patient, but for all of the people around them, as I've explained with the ripple effect. It's so important to address it with professionals to try and get that treatment done. So with the 555 number, we are looking at trying to lose any stigma about mental health, make it totally accessible at all times, 365 days a year, 24/7. So you can just pick up the phone and talk to someone regarding what's going on in your life. Now, the great thing about the Minerva situation as well is the fact that you can make it totally anonymous, and you can keep it anonymous from your work, you can keep it anonymous from your family. You do not need to be embarrassed about mental health, but I would encourage you to share it with other people, having said all of that. The Minerva system would enable you to sit in a hotel room, for example, and have a session on your mobile phone. Alternatively, you can do it with family at home. You have the power which doesn't currently exist, and this is the major changes that we're attempting to make.